Hi, it's Dr. Betty Robin with the Dentistry Rising podcast. You might know me as a dental practice sale broker from Orange County, California. I am a dentist as well as an attorney and broker, and it's my goal at this point to help you get where you want to go with your practices, to help inspire you, lead you in the right direction, and motivate you. So, happy listening. Hello, you guys. I haven't done one of these straight talk episodes in a little while because I had a lot of COVID-19 related guests on. But I don't know about you, but I'm really tired of COVID-19. And I'm even more tired of depressing posts and podcasts about COVID. I'm generally a really optimistic person, but going on Twitter these days, which I love to do, or watching the news even for a few minutes will bring anybody down. So I wanted to talk today about what is good about being a dental practice owner these days. So on the top of my list has to be that people still have teeth. And teeth get cavities, they break, they do all the kind of things teeth do because most of the time their owners don't take very good care of them. Lucky us. And people want their teeth to look good. So our profession has not gone away, really can't go away. We're not in the boat that many people are in, and we're very lucky to have a profession that doesn't and can't go away. And you can't do dentistry online. No matter how much tele this and tele that wants to make us think we can do things more remotely, I just don't see how useful that actually is. For consults, they say, if you get an endo consult, you generally want that root canal right then because you're probably in pain. For oral surgery, maybe, but you need x-rays to see where the roots are, the nerves are, etc. Maybe I'm missing something, but teledentistry is and never can be telemedicine, telepsychology, or anything else, in my opinion. We need to see our patients because we need to do something. Also, as dentists, we are almost universally intelligent, creative, and sturdy creatures. Intelligent, creative people will survive, and I dare say will come out better than before after all of this is over. And if we have our own practices, we can control our future. And that is a really important and powerful thing and feeling. To me, there's nothing really more powerful than that, is to be able to control my future. And that's what many of us, me included, hate about this whole COVID thing because just pure stupidity abounds out there. I really don't want to see any more Facebook or Instagram posts about what I should be doing. If you think it should be done, you do it, but leave me alone. This is a chance to get more efficient and more clear and more profitable than ever. When we're fat and happy, we accept a lot of expenses and put up with a lot of issues that we don't when we're lean and mean. So take the chance and get your practice together from a financial standpoint. As dentists, we really have the ability to make as much money as we want. That is absolutely true. People argue with me, say, well, I can't do this and can't do that. Well, some people are doing it. So we do have that ability. And it's just a fabulous thing about our profession. And the power in that really can't be measured. I do think a lot of things are going to change or might change and maybe should change. Some of those things included, I think more of you now will focus on your profit and loss statements. I preach this all the time. Know your numbers, know what you're spending your money on and whether you need the item. Know your goal numbers in terms of both collections and expenses and have a plan to hit them. Another thing that might change is hygiene salaries. I talk about this quite a bit too. Here in California, our hygiene salaries are ridiculously high. They just don't make sense for most practices. Many dentists are paying $50 an hour to hygienists. And that means the hygienist must produce at least $150 an hour for them to even make sense and really not produce. The office has to be able to collect, not just produce, the $150 to $175 an hour. So if it's less than that, it doesn't make sense. So if your regular fee is $200 for a pro fee or a quadruped planing, but the patient has a reduced PPO fee that reduces it by half, it just doesn't make sense. I want to see consistently, month after month, a hygiene production that collects a minimum of 3 to 3.5 times his or her salary. It certainly is possible, but it does require an adherence to a perio management program, most likely, and adding other services as well. Well, that being said, I do not include x-rays, exams, that kind of thing in hygiene production. It's got to be hygiene production, period. Other states don't really have this problem, or at least as bad as we have it in California, but here it's terrible. And just because everyone is stupid and paying that much doesn't mean you have to be. I've definitely seen offices where the hygienists are more in the $30 an hour range. So, figure out what you want. But first, I think a dentist should be doing their own hygiene if they have openings and aren't making as much money as they want. Hygienists are luxuries at best, and this may not be the time for a luxury item. Next, I think a lot of you should consider your salaries in general. Employees are your single biggest expense, many times a third or more in a lot of practices. I'd like to see that number much closer to 25%. So now may be the time to renegotiate salaries or not have someone back if your production cannot support it. Salaries are just such a huge item. I know you like the people you work with, but they have to make sense. This is a business. Another thing I think that may change is the increased use of technology, both in the front office and the back. Technology, when properly used, can do so much more now, which frees up, for example, the front office to do other things. As an example, I know some consultants in offices are really against patients scheduling themselves online. But why? I get pretty annoyed when I can't do this. I do not want a so-called relationship with the front desk person. I just don't. I want to see the available appointment times, book one, and go on with my life. I'll chit-chat when I get there, but let me make the appointment quickly and easily. I also don't want to have to call for my bill, call to see how much the insurance paid, or pick up the phone for any reason to talk to you till I get there. I want my patient portal to do all that for me. I'm sorry, but in my opinion, online is just better than the best front office person, in my opinion, because it's quick, it's easy, it doesn't require conversation, I know it is accurate, and because I can book while probably doing other things. Like in my case, hanging on a never-ending conference call. Another thing that might change is space size. Bigger is very rarely better. I know this isn't something you can do something about very easily, but if you are a newer dentist, you might want to. The practices that are the most profitable usually have closer to 1,000 square feet to maybe 1,500 square feet. If you've got like 2,000 plus, I want to see huge numbers if you're going to convince me you need more space, along with huge profitability. Huge collection numbers mean nothing if your profitability is not there. You can easily do a couple million a year in 1,100 square feet. Small space almost never holds back production. Unless you're doing Denti-Cal or something, in which case you should be in an area where the space is very cheap. I also think referrals to some specialists might change. You newer dentists particularly are really good at some of the specialty services, so do them. Or you may want to bring specialists in and have them do these services. Another good idea. And don't assume you have to pay them 50%, which specialists often ask for. Many offices and many specialists will do it at 40% or even 35%. You do have overhead, and I don't want you to lose money on the deal. So get creative and think of what you can do. So where are we? We are still, first and foremost, in control of our futures. We are so incredibly lucky to be in that position, and it is unlike many, many industries. Our thinking, our intelligence, and our creativity will get us through all this craziness. So make a plan and execute on it. We have new times and new ways of operating, perhaps. Buck up and get focused and clear. None of us went into dentistry so we can work for a corporation, although it does work for some, of course. But hold the reins and steer exactly where you want to go. All right, thank you for listening. Dr. Betty Robin. Please subscribe on iTunes